Are patients involved in designing their own smiles, yes or no? It's a tricky question because the answer is yes and no. When we're doing cosmetic work for a patient, veneers or crowns, whatever the case may be, a patient will obviously say to us, look, I want the front teeth a bit longer, or I want the edges a bit squarer, or I want it wider, I want it whiter. And yes, we implement those things, but to a certain extent or within limits. Now, those limits being the natural framework of the patient's face, so the lips, the face shape, the length of the upper lip, that sort of thing. So you'll often find that what someone wants or what a patient wants is based on what they've seen on someone else. So you can't generally replicate that exact thing on a different person because they look different. Their faces are different shapes. Their lips are, the fullness is not the same. So if a lady comes in and she says, I want Julia Roberts to smile, yeah, there's certain things that we can implement from that, but that look, that sort of wide smile, we might not be able to implement or to give that to that patient just because simply she doesn't smile as wide. So yes, we do take into account what a patient wants. Those little small changes we do make, but generally it's impossible for us to try and replicate something from a specific person and give it to someone else. What we also need to take into account is we don't always want someone to just have a beautiful smile. We want them to have a healthy smile as well. So if a lot of the times a patient will come in with an expectation or a result that they want, but that might be extremely destructive in the long run. And that's not something that we want to do in that specific way. So we need to remember that it's not only about looking good, it's about feeling good as well and being healthy. So again, it becomes a very much a collaborative effort. So it's a discussion that you need to have with the patient and between the patient and the doctor. So sit down, discuss the whole thing, get the pros and the cons and the advantages and the disadvantages, get to the end point and how you're going to get there. It's how you're going to get there that's the very important part, to maintain the health of the teeth, but also to look good in the long run.
Your dentist, your choice.